This week I saw one of the most complex injuries I've ever covered. Come take a look. Raul Payne, a Marlins player, was injured after this landing, and a lot of things can happen here. Here, he lands on the opponent's leg, which just moved, so his left leg twists to the left and backward, and then he collapses to the ground. Usually when I cover an injury, there's a problem with one joint, sometimes even an entire limb, but here a lot of things are happening. Let's start systematically with the left leg. Here, during the fall, as the leg is pulled to the side, you can see the adductor muscles, our groin muscles, and this collapse of the knee can cause a tear in the cruciate ligament, the MCL, the medial ligament, and the menisci. He also twists his ankle. But after saying all that, it's actually the right leg that concerns me more, also because he grabs it immediately after the fall. Regarding the knee and ankle, it's the same issues as with the left leg, but here we also see a very strong inward fall into a position called the W-sit, which puts a lot of rotation on the hip, and that's dangerous. Three main things can happen here, as well as various combinations of them, and the first is a dislocation of the femoral head. That is, the hip actually comes out of the acetabulum, the socket in the pelvis where it sits, and then many things can happen, including fractures, cartilage tears, and more. The second thing, because of this aggressive rotation of the hip, is a spiral fracture of the femoral neck. And the third thing that can happen here is damage to soft tissues, such as the cartilage of the hip, the cartilage of the acetabulum, the labrum, as well as nerves and blood vessels. Of course, with all this aggressive movement, there will also be tears in muscles, tendons, and ligaments. By the way, he landed with such force that it's not entirely clear, but it even looks like he hit his head on the court. Many times when I analyze an injury, I look for other angles or for the treatment by the physiotherapist or doctor on the court, but here there really isn't any of that, just this picture of him not on a stretcher. Actually, this is quite a reassuring picture because you can see his legs are at the same height. If he had dislocated his right hip, we would see it higher, meaning the leg would be shorter. And hip dislocations, unlike other dislocations, are not put back in place on the court, but rather are treated at the hospital. So unfortunately, up to the moment I'm recording this, there is no official information about exactly what happened to him, but it's pretty clear that his season is over. And I'll already answer now the question I get asked a lot in the comments: will he return to play? The answer is yes. Today, with modern medicine, there are almost no injuries you can't come back from. Maybe he'll return at a lower level, but still, there's no reason he shouldn't play basketball again. Probably after a long rehabilitation, but he will return. In any case, wishing him success.